Can hearing problems cause speech delays? Imagine trying to learn a new language without hearing any sounds. It would be almost impossible to pick up the words and pronunciation. Now, think about how this relates to children learning to speak. Hearing is a key part of how they develop communication skills. When children cannot hear well, it can affect how they learn to speak. Hearing helps children listen to the sounds of words and understand how they fit together. If a child has trouble hearing, they might miss important speech sounds. Missing these sounds can make it harder for them to learn how to produce words correctly. Even mild hearing loss can cause delays because children might not get enough auditory input to develop speech skills normally. Hearing loss can happen in one ear or both ears. When it affects just one ear, it is called unilateral hearing loss. When both ears are affected, it is called bilateral hearing loss. Both types can lead to speech delays, but more severe hearing loss usually causes bigger delays. This is because the child misses more sounds and has less access to the full range of speech. The age when hearing loss begins and is identified is very important. If it is caught early through newborn hearing screening, intervention can start quickly. This early help can make a big difference in how well a child develops speech. If hearing loss is not diagnosed early, delays can become more noticeable and harder to overcome. The type and severity of hearing loss also matter. Sensorineural hearing loss, which involves damage to the inner ear or auditory nerve, is common and can make speech perception difficult. Children with this kind of loss might struggle to distinguish similar sounds, which affects their speech clarity. Interventions like hearing aids or cochlear implants can improve hearing. When children use these devices consistently, they are better able to hear speech sounds and learn to speak more clearly. Speech therapy is also important to help children develop proper pronunciation, vocabulary, and sentence structure. Children with hearing loss often feel frustrated because they cannot hear or understand others well. This frustration can make them less confident in talking and sharing their thoughts. Sometimes ear infections cause temporary hearing loss, which can delay speech development for a while. Once the infection clears, hearing usually improves and speech can catch up. Since speech develops through daily listening and interaction, hearing loss disrupts this natural process. Without enough auditory input, children might struggle with speech sounds, word formation, and sentence building. Some children might also learn sign language or lip reading to help communicate better. Speech pathologists work closely with audiologists and families to assess hearing and support speech development. Early intervention, ideally within the first 3 years, is vital because this is when children are most receptive to learning language. They can recommend hearing devices, therapy, and communication strategies to help children develop clear speech. In summary, hearing problems can cause speech delays because they limit a child's ability to hear and process speech sounds. The sooner hearing loss is detected and managed, the better the chances for children to develop strong communication skills. Proper support and early intervention can help children overcome these challenges and succeed in their speech and language development.